The number one thing for spinal care and comfort, hands down, is nail care. If you can hear them on the ground, the nails are too long. I always try to compare this to if you were to wear a pair of shoes that was a size and a half too large, how do you think you would walk? Pretty strangely, right? You might be tripping, leaning forward, trying to adjust your body to balance it, to offset that extra length.
Many pet owners hear the word holistic and think it means alternative, soft, or even unscientific care. But in veterinary medicine today, holistic is often about comprehensive, integrative care, combining conventional diagnostics and supportive therapies that help the whole animal. Today, I'm joined by Dr. Emily Roth, the founder of Healing Trails Holistic Veterinary Services, and better known online as @HonestVetTalk, a veterinarian who blends science-informed care with pain management, acupuncture, spinal health, and communication that many pet owners find relatable and reassuring. We're going to unpack what holistic actually means in a clinical context, when modalities like acupuncture and physical medicine can add value, and where the evidence supports them, and how this all fits with conventional veterinary care, especially for chronic pain, mobility issues, and quality of life. We'll also tackle end-of-life care with compassion and clarity. Dr. Emily, welcome. Welcome to the Pause and Effect podcast. Thank you so much for joining me.
Thank you for having me.
Oh, so good. I am particularly interested in the work that you're doing. Particularly, you're doing both large and small animal, and I'm going to start there. How are you managing to do both? Because as a small animal veterinarian, I feel there is just so much to know about smallies. I can't imagine now having to deal with large animals too. How do you manage both?
So typically, for me, my situation's rather unique. I don't practice general medicine on either small or large. I only do complementary therapies like spinal adjustments. I practice Chinese herbs, Chinese medicine, acupuncture. So it's not as hard as it would seem because it's a very specific skill set that I'm working with, and it's not general mixed practice like some people do, which I think is definitely a skill and very admirable. So yes, it is definitely a skill to have, but it's not as difficult as I think general mixed practitioners have.
So how did you get into this field? What led you to sort of this niche, as I would refer to it, part of veterinary medicine?
So interestingly enough, I started having these therapies done on myself. I am a competitive long distance runner, and I had a lot of injuries because I ran a lot and I was in a lot of events. And I initially started with acupuncture on myself for pain management. And then I ended up seeing a chiropractor. And I thought it was very interesting how good of results I could receive without medication, without surgery. And this is not to say it's a replacement necessarily for either of those things. However, that piqued my interest. And then when I was in undergraduate, I did 2 different externships, one with an equine veterinarian and the other with a wildlife rehabilitation center. And both of those facilities had veterinarians that practiced acupuncture. And I was like, this is really, really cool. And you can see results because you either see it or you don't, right? Because animals don't know what you're doing to them. They don't know you take this pill and you get this result, or you have a massage and you feel better. They either do or don't. And that kind of speaks to the placebo effect of acupuncture in animals. There really isn't one because they can't cognitively understand that. So, I was observing this. I could see that the results were very, very obvious and palpable. And therefore, that before I even went into veterinary school, I decided that I wanted to go to veterinary school to be a veterinary acupuncturist.
Oh, incredible that you know before you even start the course. It's most people sort of go in going, I don't even know what species I'm going to be working with. So
Right.
very rare. So that we can get this question done right at the start, because I know we'll go into sort of holistic and integrative medicine and what that means, because I think it's important to set the scene. What is actually happening in acupuncture? For those who are doubtful, maybe haven't received it on themselves, are not sure about the alternative therapies that are coming into play in our profession, how does it work to a lay person?
Yeah, so that's definitely, I was very excited that you were going to be speaking about some of these terms that are being, used, quote unquote, thrown around, right? Yeah. It's really not alternative medicine. It's truly an integrative approach. And that is how I practice medicine, is I combine Eastern and Western modalities, because I think you really can't have the best treatment and the best protocol without involving both. And acupuncture, there's a lot of science behind it. There's been many, many studies done in humans and in animals. We know that it increases the feel-good hormones in the body, serotonin, and works on opioid receptors as well. In addition to, it works with something called the gate theory by blocking pain signals quicker. And that's kind of like if you have a bug bite and you slap it, it kind of takes that signal away. So it works by the gate theory. We also know that it increases the ability for your immune system to work better. So post acupuncture, they have taken blood and seen increased levels of T cells in the blood, which is pretty fascinating. It also increases blood circulation and different growth factors. So there's not one specific thing that it does. It does a lot of different things. And it does also depend on which acupuncture points you're using, in addition to if you are using electricity with the needles or not.
I think that was one of the fascinating things I saw from your social media, and we'll talk to the listeners so that they can go and have a look for themselves. But that I was watching how you obviously have inserted the needles and then they are vibrating and you have attached electricity essentially to them.
Yes.
So what is there additional benefit? What is it? Is it better because you have that electrostimulation, or what is happening there?
So I get that question from clients a lot, and people in general when they're just talking about acupuncture. Dry needling, meaning you are simply just using needles and not adding anything to it. You can also do something called moxibustion, which is using a warmed herbal stick, and you can actually warm the needles, which will increase the stimulation of that particular acupuncture point because the needle is being warmed. I think it's not that it's necessarily better, but it is a stronger stimulation in certain situations. So I've been doing this for quite a long time now, and I've worked on hundreds and hundreds of patients. And I would say that I have plenty of patients that get the exact same results with dry needling than they do electrical stimulation of the needles. However, I think in more difficult cases, particularly neurologic cases, when they have decreased neurologic function and the signals aren't firing already very well, adding that additional stimulation on, I think, is very beneficial.
Interesting. So I'm sure we're going to talk a little bit more about the acupuncture, but let's take a few steps back so that people understand some of the terminology. I mean, you talk about being a holistic vet. What does that actually mean?
So the word holistic in and of itself just means you're looking at an entire entity instead of a separation of its parts, right? And I do think in general, even Western oriented veterinarians, that are more Western medicine trained, still to some degree treat most of their patients relatively in a holistic manner. However, I do think sometimes people that are sometimes colleagues and even other medical professionals, not veterinarians, are a little bit more parts oriented. They don't necessarily look into the root cause of why things are happening. I think in general, over the past, I don't know, probably since I've graduated, I've seen that more veterinarians are focusing on whole body wellness instead of just kind of we call it Band-Aid medicine, right? Like, oh, you're vomiting, here's a pill for that. Or, oh, diarrhea, here's some metronidazole. I mean, I'm sure you've experienced this many times in practice. And when I was very, very first starting in a very busy practice, sometimes that was all I could do because I was either limited by funds or time, or, it can be rather frustrating. And sometimes you just have to throw something. But I think holistic really, it's whole body treatment, and it's looking at the root cause of why things are happening, not just your dog is itchy, here is some Apoquil, or here is a Cytopoint shot, right? So we're kind of breaking down the health of the animal into a more comprehensive plan. And something I want to clarify as well that is always frustrating to me when somebody calls and is inquiring about services from me because they say, oh, you're holistic, so you don't believe in X, or you only use natural treatments or natural options, which is a very slippery slope, I think, to get into, because that is natural doesn't always mean better.
I agree.
And natural is not always the best option, because if something has a severe infection and a fever, sometimes it needs antibiotics. And I certainly would not want to be the person to say, oh, well, let's try this essential oil first and then see if. So it does become a little bit hairy for me sometimes, because even, and I know you've spoken to people about vaccines as well, and so that does come up rather frequently. I have had people call and say, oh, well, you're a holistic veterinarian, you don't believe in X, Y, and Z, or you don't believe in vaccines, which is just simply not true. And it's a disservice to how integrative veterinarians practice medicine, and it's a disservice to the whole community, frankly. So
absolutely. I mean, I can see how it comes about, because, especially when we're talking about different ways of doing things, whether it's, practicing Western versus Eastern. I think when I discuss a holistic type care, and from my perspective, a lot of that, I mean, nutritionally, in terms of managing UV light in a positive or negative way, that's a different subject. But a lot of my colleagues think I'm going as extreme as homeopathic suggestions, or, like you say, natural remedies, where I'm going to be, recommending coconut oil, rather than something that is actually has got scientific backing and a basis to it. Is this as extreme as you find it in the work that you're doing?
I would say probably, I would say 20% of inquiries probably are on that level. And, there's a lot of science behind a lot of different supplements, and Chinese herbs have been extremely well studied. Acupuncture has been well studied. Spinal adjustments have been well studied. Red light therapy, laser therapy has been pulsed electromagnetic field therapy, or PEMF, if you've heard of that, and we can talk about that if you want. There's a ton of science behind it, and even coconut oil, MCTs, right? There's been studies on MCT, all right, but it doesn't mean that CBD. We could keep going, right? Like these are all valid options, but it shouldn't be this or that. It should be this and what else can we do, especially on the Western side, if there's a really significant disease process. And then sometimes what I find is it ends up being more here, right? It's not this or this, it's in the middle. And a lot of the times my patients are on multimodal therapies. I have plenty of patients on steroids, antibiotics, NSAIDs, but we've been able to significantly decrease their Western medications so that their side effects are much lower.
That's a very...
And frankly, an increase in both quality and quantity of life.
Yeah. No, I can see that. I mean, because we are all, ultimately trying to do the work that we do without causing any additional harm. And certainly, sure, if you can minimize the dosage or the duration, we are all sort of, trying to get to that point, rather than that, as you've mentioned, like sort of that blanket treatment of, I only have time to throw one thing at this, and it might be metronidazole this time.
You look at me, I look at you, I see the love in your eyes.
Health you can see, love you can feel. Ultrapit, the science of love.
Let's talk a little bit more about acupuncture. I'm very interested in talking to you about general, for me, just because I haven't touched on the subject enough, of general measures. I mean, I know that you're really active, you're really outdoors, it's the way you live your life. And some of that stuff obviously influences the work that you do and the recommendations that you make for pets, which I absolutely love.
Yeah.
So I think a lot of people who have had acupuncture maybe have an understanding, but for those who don't, what are the kind of conditions that you most commonly recommend sort of acupuncture? Is it for pain? Are these for like major spinal issues, neurological cases, post-surgical? Where do you generally make these recommendations for acupuncture?
That's a fantastic question. And frankly, almost any patient can benefit from acupuncture because of its wide ranges of operation in the body. So pain is probably the most common pain / orthopedic neurologic conditions, I would say, would be the most common that I'm treating. I also am using it relatively frequently for chronic GI conditions because there's a lot of scientific backing. That's not necessarily the only reason why I do it, but we know that it can help with chronic, both constipation and like diarrhea, inflammatory bowel disease, and a lot of cancer patients as well, both on the pain and nausea front, because there are specific acupuncture points that can decrease nausea, and that is, I don't know if you've ever seen the C bands that people wear for motion sickness, if on a boat. So that is actually an acupuncture point on the wrist where you're placing that band, and it's causing acupressure on a defined acupuncture point that has been researched to decrease nausea. So that, I would say, pain, orthopedic, neurologic, chronic GI would be the most common. And then neurologic conditions, both IVDD, like disc disease, degenerative myelopathy, dogs that are struggling with DM. Seizure patients also respond extremely well to acupuncture and Chinese herbs. And there are plenty of studies involving scalp and auricular ear acupuncture to decrease seizure frequency.
So interesting. And what are the limits? Are there pets that don't respond well, or are there conditions where acupuncture just would be inappropriate?
So it's very important. Speaking of seizures, again, it's very important for seizure patients to not introduce any electricity around the head or neck, because what is seizure? What is a seizure? It's an abnormal electrical response in the brain. So we don't want to add any electricity coming in. I still have patients that both struggle with spinal disease as well as have seizures that I will do electrical acupuncture towards the lumbar and pelvic region, the hind limbs, but I stay very, very far away with the electricity on the head. So it's not really a contraindication, but a specific type of acupuncture. You do want to be very careful with seizures. There are certain points to avoid in pregnancy, specific acupuncture points, but it's not contraindicated in pregnancy. It's just if you don't know what you're doing, that could be not ideal. And frankly, there's really not, there aren't major contraindications for acupuncture. Obviously, you wouldn't want to be putting needles into open wounds or anything like that, right? But and you don't necessarily want to, certain cancer patients, you need to be, depending on what kind of cancer it is, you do need to be careful about where you're placing needles and the duration. Sometimes electricity is not necessarily recommended depending on the condition. And then in terms of response, so there's a study for that too. They found that there is a small subset of humans and animals that just simply do not respond. So it's a very small number. I don't remember the stat off the top of my head. I will be honest. I don't have that committed to memory, but it's very small. So it is possible to have what is called a non-responder, both on the human and the animal side. There are some people, I have a couple of clients, that come to me for acupuncture. They say, well, I didn't do anything for me. I'm like, well, you might just be a non-responder. And I have certainly had a few patients be non-responders, and it's always a bummer. And there is no telltale anything that I can look at to say, I know that this patient is going to be a non-responder. However, typically what we do is we give it 3 sessions, a minimum of 3 sessions. And if we're not seeing any response whatsoever, it's likely that we're not going to see a response.
I mean, obviously, there is a myth. There is a perception that acupuncture is just poking needles. How do you explain to those who say that the clinical purpose and sort of the targeted nature of the points that you choose?
So acupuncture, and again, there's studies, they have shown, and we've heard this word called meridians, right? Or maybe not. They are the defined channels, acupuncture point channels along the body. And I wish I had I didn't think to have a demo, but they actually looked at where all of these defined points are along these meridians, and they found that there is an electrical difference in the body along these channels or lines of acupuncture points. And a lot of acupuncture points are along large vessels. They're along large nerves. So if you want the science, that explains it. And, thousands of years ago, the Chinese didn't know what that meant. They just realized that, oh, this works really well. And they kept doing it. And then when more modern science happened, people started to look into the science behind it and found, oh, well, there's a large lymphatic that's running through the arm here. There's a large vessel. There's nerve endings. There's conglomerates of histamine that are sitting along these channels. So, and also an electrical difference, right? Because we're all energy, and the body has different energy levels depending on what portion of the body you're in. And they found that that's kind of how those things correlated.
Interesting. So moving to spinal adjustments and some of the physical medicine that you do, how does sort of focus mobilization or this chiropractic care that you're doing like help animals? What happens there? When do you choose that, for example, over acupuncture?
So patient selection is definitely an important thing. Some patients, so spinal manipulation in and of itself is not particularly painful. However, I don't know if you've ever been adjusted. I've been seeing a chiropractor since I was 19. I've been in chiropractic care for many, many years. Some adjustments particularly can be a little bit uncomfortable. So I have to be careful, right? Because at the end of the day, my body is how I work. So dogs have teeth, cats have teeth, horses have very large legs and teeth. So I do have to look at it from a pain and a behavioral perspective first. And also, a lot of the times I'm doing both acupuncture and spinal adjustments. It's just very dependent on the patient's behavior, pain level, and then sometimes also age. And age, and I will say this with the biggest grain of salt because I preach this so much, so I don't want to put myself in my own rabbit hole. Age is not a disease. Age is not a condition. However, some of the more debilitated patients that are really struggling with pain and weakness, you have to be very careful about how many treatments per session, types of treatment, right? So I'm not going to acupuncture, do an adjustment, and laser and PEMF, and I'm going to do some kind of injection. I'm going to be very selective because the body can only take so many treatments at one time, or you might get very sore or very tired. And I don't know if you personally have ever experienced this, but it would be like you've never had a massage, you've never been to a sauna, you've never had dry needling, and then you do all three of them back to back on the same day. Your body is going to be very overwhelmed with that amount of stimulation. And right, we're releasing a lot of different chemicals and hormones within the body because of these treatments. And so we don't want to overload it. And it's not that you're going to hurt the patient. It's just they can be a little bit tired, and sometimes they can be a little bit sore because you're working a lot of things and you're moving a lot of things that haven't been moving well for a long time, right?
So I'm going to go back to how I started our conversation.
Yeah.
We're talking the fact that you do horses and cats and dogs. Mm-hmm. Is veterinary chiropractic the same as human? And are there any species-specific differences?
Yes, there are species-specific differences, right? Because the anatomy is it is different, right? Because humans are bipeds and horses, cats, and dogs are quadrupeds. So, and our anatomy is not 100% the same, right? It's very similar. And also, you go to the chiro office and a human just lays on the table and they give you their leg, they give you their neck, they give you their head, right? So they flip over, and they know what you're doing. And so that's very different. I actually did bring a prop because I love to do this because a lot of people don't even actually know what's happening within a spinal adjustment, either on themselves because they just go and have it done, and that's just what they've been told, go have an adjustment, and they blindly trust someone, which is, there's a caveat there too, right? Because there are bad adjusters, right? There's people that are not as skilled. And it doesn't mean that they're bad doctors, but if you know the background behind somebody's skill level in terms of adjustment, I think it's really important. So I have I don't know if you can see this.
Yes.
But this is a thoracic vertebra of a horse. So really all that's happening with spinal adjustment is we are working with a joint or a spinal segment within its normal range of motion, right? So this joint goes up and down a little bit, right? And then it goes side to side. Okay. So all that we're doing is working with that joint within that normal range of motion. This joint is not like this, and then we're taking it back to here, right? What can happen with stress, inflammation, injury is, so this is how this joint stays in its general sense, but it might go just a tiny bit that way. And due to injury, so say the horse fell, say it got kicked by another horse, say it's an extremely athletic, high-level performance horse, barrel racing, jumping, whatever, it doesn't matter. And it's stressed, maybe it's been traveling a lot, was in the trailer, held itself wrong. So now this vertebra from here goes to here, right? All we're doing is just moving it back so that it can move in its normal range of motion. That is all spinal adjustment is. It is not taking a bone from here to here, right? And so there's a term that's used very, very commonly, which hopefully people are moving away from. And I sometimes catch myself because we get into slang, right? We like the slang terms. We like we like to sound cool, like we're doing something cool, right? But it's called bone out of place. And a lot of chiropractic used to say, oh, well, your neck is out, right? What does that even mean? No, it's not out. You don't have a cervical vertebra that's over here that needs to come back. You didn't dislocate your neck. Somebody didn't break your neck, right? So really all spinal adjustment is, or chiropractic, is just working with joints and spinal segments within its normal range of motion. And I hope that that's a good explanation and a visual, because a lot of people think we're doing something really, really drastic and off the wall, and it's so minor.
That was excellent. I love the fact that you gave us a visual on that. The other thing I want to understand, and I asked because of my own interest in the answer, what is the pop? What is the sound that you hear when there is an adjustment?
So that's called a cavitation, and it's just gas in a joint space, right? Much more common in humans, much more common. We do certainly hear those things in animals, but it's not nearly as common. And you'll see these videos I know you know what videos I'm talking about, all over social media and the internet, of these, animal chiros, and they're trying to make a lot of sounds, or I think what they're actually doing is dubbing over sounds with the adjustments. It's very uncommon, particularly in dogs, to hear cavitations. I'm not saying I never get them. Certain joints, toes, very common. Shoulders, very common. Sometimes the neck, I will get cavitation on very specific adjustments, and very rarely thoracolumbar. But I would say in dogs, it's pretty rare. Horses, a little bit more common. We'll hear some cavitation, but it should never be a goal. My goal is not to make a noise and make a show. I'm there to do my job and make animals feel better, right? And the other thing that I like to explain to people as well is what a true adjustment is. It is a high velocity, so high speed, right? but low amplitude. So we're really working within like a small space instead of, right, because amplitude is the size of your wave, right? If we want to go back to physics. I didn't think I would be giving a physics lessons today, but so it's a very low amplitude. So we're really working within like a small space, right? Because this joint, if we were moving it from 90 degrees, that would be very, very bad, right? That would mean that the spine would no longer be valid, right? So we're really, we're working with a small amplitude, so a very small space, but it's a high speed, so high velocity. So thinking, the velocity of a car or an airplane. So we're going very quickly, but we're not taking an adjustment in a large, from here to here. It's just from here to here. So it's very small.
So, I mean, we made mention of the risks associated just generally working with animals, horses with their strong legs and their teeth, and cats with their claws and their mouths and
their teeth.
Dogs and their teeth. But how, in terms of, is there some patient selection? Is there some sedation that's required? How do you manage ones who, as we know, may not even want to be touched? Giving an injection is difficult in some of our patients. How do you manage the process?
So opioids in particular, right? Because acupuncture works on the opioid receptors, we try not to use any kind of opioid sedative because it can decrease the effects of the acupuncture. It doesn't completely negate it, but I mean, if we're going to do it, this is not to say that I've never done acupuncture on patients back when I used to be, when I used to do surgery, because I had plenty, like I would have a lot of my colleagues say, this dog we can't even touch, but it's got bad hips or whatever. Can you put some needles in for us? Can we do a treatment while it's waking up from its dental or whatever? So, I'm not saying I have never done it, but in my current practice, I do not sedate animals. That's just other than for euthanasia. So I don't sedate my spinal manipulation or acupuncture patients. Some of my patients I will have come in on gabapentin and trazodone if they need it. And there are some patients that I can tell like this is just not going to happen. And for me, my safety and my staff safety is the most important thing. And I'm not really willing to put that at risk to perform a particular treatment. I would say that probably only happens about 2% of the time where I just say we just can't. I'm sorry, but I've had a couple. I mean, I had some horses with some like Dromosidane gel, alpha 2 sedative. But I don't give any injections prior, but most of them are pretty darn amenable. You would be relatively shocked. The one species that is not the best is, you're going to guess it, is cats. But I've had some wonderful feline patients, but they're a very small subset that are tolerable. I do a little bit more laser therapy on those. And the cool thing that I can do and this is another answer to your question as well, is my laser has an acupuncture probe that will focus the laser into a very finite point. So I can actually still basically perform acupuncture without needles and just using the laser stimulation.
Oh, incredible. So good for those sort of patients.
Yeah, and I do it on horses a lot too, the horses that are a little bit naughty. So before we move off this topic, if they're agility dogs that they might be stiff after a competition, how do you know that it's not stiffness and it actually needs sort of rehab or adjustment or treatment? I would say in general, most of those animals need some form of treatment. It's kind of like, I akin it to to humans, right? Because it, particularly myself, because I'm still an athlete, and I'm still, I train 6 days a week. I'm still running. I'm a weightlifter as well. So I would say, usually the stiffness type muscle situation is more of a manual, like massage. I mean, I'm not specifically trained in massage. However, I do have some experience with massage therapy, from my previous work. But I didn't take a specific massage course. A lot of the times muscle soreness can be addressed with laser or PEMF, or pulsed electromagnetic field therapy, or dry needling. If they had a really hard run, or a really hard event, typically I will address the muscle first, and then we come back for adjustments maybe later, unless somebody says, my dog came off really hard off the A-frame, or really hard, off this jump, or they kind of crashed and burned. Then we'll assess. But a lot of times it's exam based. So it can be, feeling those spinal segments and saying, is this dog very, very low in its mobility within its joints and its spinal segments, or is this all inflammatory muscle situation that we need to address? Because a lot of the times, if you don't address muscle, and this is very much the same for humans as well, if you don't address the muscle tightness and soreness, your adjustments are not going to work very well, right? Because what happens, I'm going to bring this back. Okay. So the muscles that are running along this, right? If they're extremely tight and you're moving this spinal segment just a little bit and everything is really, really tight, if you adjust it and you don't address the muscles, guess what's going to happen? It's going to go right back, right? So, and this is I've experienced this in myself many, many times. So I have both a body worker and a chiro, because there's no point in doing just one, especially when you're that hard on your body, because you really need both. And that's the multimodal integrative approach there, right? And God forbid, I might take an NSAID, right?
Yeah, that's a great example of it.
And a lot of my patients are on NSAIDs, know?
So what are some of the practical things that owners could do at home to help support their cats, dogs, horses that can just manage spinal comfort and general mobility?
I'm very excited that you asked this question, because it's something that I'm extremely passionate about and I really enjoy. And I think a lot of people don't realize the importance of it until I explain it. And then they really get it. And we see a massive improvement in spinal comfort and just general comfort overall. So the number one thing for spinal care and comfort, hands down, is nail care. And I know we've all seen these dogs that clearly may have never had their nails trimmed. If they do, they have to be sedated. We've seen large animals and small animals with extremely flat-footed, very distorted feet, very distorted toes. This applies to dogs. Cats, not nearly as much, because most of them will take care of their nails for the most part in terms of sharpening, but they should still be trimmed to not allow. Hey. Yeah.
Must be part of the combo.
Yeah, it's just, we have the peanut gallery. Hey, nobody needs to hear that. Thank you. So
Cats.
Yes. And she's protesting because I do her nails every 5 days. And she's an agility dog. So very, very important, even more important for performance animals. But I really don't like to say only if it's a performance animal, because it's just extremely important. And so there is a practice of postural rehabilitation, and this is something I'm trained in. It's it's a component of spinal adjustment, basically. And what we're looking at is how the body interacts with gravity, right? And this can be applied to humans and as well as four-legged creatures. I mean, everything interacts with gravity every day. It's a constant, right? And so that is also a really large portion of how I approach my spinal patients, is looking at their relation to the ground and how they stand, how they walk, right? And one of the biggest things that you can do as a pet owner is making sure that the nails stay as short as possible. They say, my mentors in this particular realm say, if you can hear them on the ground, the nails are too long. And it's not always just trimming the nails. It's also having those animals adjusted so that then they are in proper alignment when they're in gaiting, right? When they're actually walking, trotting, cantering, whatever. But I always try to compare this to if you were to wear a pair of shoes that was a size and a half too large, how do you think you would walk? Pretty strangely, right? You might be tripping. You would very likely be leaning forward because you're trying to adjust your body to balance it, to offset that extra length of your shoes, right? So what's happening is when those nails are extremely long, it's causing our four-legged patients, and this also applies to hoof care as well, right? So to horses, what's happening is they're actually pitching forward because they're trying to adjust their posture in association to gravity. And when they're not standing in the center of the gravity of their limb, they have to adjust so that they don't fall over, right? So what's happening with a lot of these animals is their nails are extremely long, they're extremely pitched forward, and everything comes from the bottom up, right? So you're straining different muscles, you're putting different strain on all of those joints on the lower cervicals, right? So, I mean, I'm not going to get on the ground right now, but the lower cervicals, right? Because that's that junction where, the thoracic limbs come up into, the lower cervicals and their entire spine and all of their musculature has to adjust for their very, very poor posture.
Incredible.
So nail care, particularly not just clipping, but dremeling dog nails so that when they are standing on the center of their central paw pad and all of the digital paw pads. And when you hear them come down the hallway, you don't want to hear it.
Wow.
Does that make sense?
Yes, but it's my mind is blown because I'm so used to hearing that click, click, click of nails.
And when I explain it to clients, they're like, it immediately clicks and they're like, oh my gosh, I can't, that makes so much sense, right? Because they cannot understand their relation to gravity when their nails are the first thing that touch the floor. And if you look at animals in the wild, both horses and dogs and cats, they have the most beautiful perpendicular posture and their nails are not touching the ground. And, you don't see those super long slippered hooves, of feral horses because the domesticated world has really changed how animals live and their posture. And it's very negatively affecting them. And so nail care is by far, from a spinal perspective and from a joint and arthritis perspective, to me, the most important thing. And please, pet owners, if you get a young dog, make sure that, playing with their feet and having that, having that exposure when they're young is a priority to you, because it will make things so much easier. I have seen dogs, with completely flattened flexor tendons and just, horrible posture. Their feet are just absolutely wrecked. Their tendons are wrecked. We've done multiple Dremels, sometimes twice a week, for about 6 weeks. And I have been able to see those feet normalize and the flexor tendons firm up and they're not dropped. But it takes a lot of time and it takes a lot of work. And a lot of people don't want to do it. And a lot of people don't want to trim their dog's nails. And especially because a lot of them don't like it.
That's great advice. Start when they're young and get them used to it. And one of the things that they teach even within our puppy school here is just that, on our pleading and instruction, touch their ears, touch their feet, touch their tail, because when there is a problem, whether it's managing an ear infection or trying to do a basic nail clip or
take a
dealing with trying to take a temperature, popping that thermometer, they are horrified. Like, no one's ever touched my tail. So it does make a big difference in terms of handling and care, particularly when things are a problem or there's an illness or an injury. So great advice. There is a number 2 on your list, because you couldn't have said top, but you've got something else. So tell us what the other suggestion is.
So number 2, and I had seen that you had covered this with another veterinarian as well, but I'm going to reiterate it because I think it's extremely important. Weight management. It is so important. And this has nothing to do with your own views or how you feel about your own body. So many people have struggled. I myself, I will be very personal and share with the world, because I'm just a normal person. Just because I'm a veterinarian doesn't mean that I haven't had struggles. I used to be significantly overweight. Significantly. And a lot of people don't know that. And I have struggled with that for many, many years. And I'm not immune to issues, right? We're just people. We all have our own struggles. So, but we know there is a direct link, and also there is a number 3 too. So, there is a direct link to longevity and inflammation and the amount of body fat or body condition score, right, in animals. We know this. There was a study released, right? And my lean patients they live longer, they have less pain, and they have better mobility, hands down. There's no denying that, and there's no refuting that. And I understand that we love our animals and we love to give them treats and we want them to be happy and all of these things. But at the end of the day, it's our responsibility to take care of that animal. And part of that is making sure that they are in a healthy body, and a lean body condition score is part of that.
Thank you for sharing that. I mean, the other stuff that you present and you share with us on social media is how much time you spend outdoors, the fact that you're very passionate about sort of mental health and sort of that probably ties into the work that you enjoy doing or that you do within the veterinary field. From that perspective, where has that influenced the kind of advice and the way in which you are sort of also conducting yourself in terms of the work that you're doing? How has that influenced your life?
So one of the biggest things I think that I want to make a point for people in general is that it is our responsibility, if we are going to take that life into our home and into our own hands, that it's our responsibility to make it high quality, to give it a true, joyful, loving, earthly experience. And I think, and it's tough, right? Because we all love and admire animals, and sometimes we put a lot of our own emotional well-being and our stress and our reasoning into that other being's life. And one of the biggest things that I have discovered within myself, particularly being in the outdoors and experience a lot of that with my dog, is that I'm responsible for my own life and my own happiness, but I'm also responsible for making sure that this animal also has a true living earthly experience. And she requires more than, just a half-mile walk twice a day and for me to put the food in the bowl, right? And I see so many behavioral issues in all of our animals because people are acquiring a being and they are having it exist in their home, but they aren't really giving it what it truly needs. They're giving it basic needs, but they're not giving it this like living earthly experience. So I just think that's really important because I do feel that there is a level of suffering that is occurring that could be mitigated by expanding how we interact and treat our pets.
I mean, and there's some things that you practice, and I mean, I really relate to this, and I really admire some of the content that you put out there. Whether it's walks or getting sunlight, or whether it's hot or cold plunges and those sort of therapies. I mean, as you said, when you have had a response or a positive response to some of the changes or decisions you've made in terms of integrating these things into your daily or your lifestyle, you can see and you want to be able to provide that same opportunity for pets. Is this where a lot of the holistic medicine also comes into sort of your approach to cases?
Sure. I mean, I think I definitely try to practice as much as I preach, for sure. It's not always easy, right? And I understand a lot of these things are not inexpensive, right? But I think like you have one body, right? You don't get round number two, right? So, and I think it's very possible to make improvements, even if you've gone years neglecting yourself, and I don't want to say neglect in an abusive way, but ignoring and sweeping under the rug things that may be beneficial to you, and health is not linear either, and that's the other thing that I think is really important, because I see a lot of patients as second opinions, and I have had, and this is not to speak ill of other veterinarians. I think sometimes, depending on what we've studied and what we've experienced either within our career or within our own personal bodies, right? Our levels of experience are going to be different, but I do have a lot of second opinion consults that, clients have been told there is nothing that can be done at this point. And I look at their records and I'm like, one thing has been done, and there might be 10 that have not been tried. And these are both on the Western and the Eastern side. So it's not like, oh, I have this this extra thing that I'm so good at. And, I can't believe somebody didn't suggest this, but it's like, basic things like anti-nausea medications or sub-Q fluids or, palliative type options. Even if it's a kidney patient, maybe we try low dose non-steroidal just to see, as long as they understand the risks, all of these things. And so I think we have to understand that health is not linear, and you can start at any point in time with yourself, right? You can start walking more, you can get more sunlight, you can get better sleep, you can eat more fiber, you can do all the things at any point in time, and you will be better no matter what, even if you start at age 20 or if you start at age 55. It doesn't matter. And I think it's this, I have seen that it is the same with pets. Now, doesn't mean that we can perform miracles, but it's really never too late, to be honest, in my opinion, and in my experience.
And when you talk about quality of life, how do you help owners assess it clearly? I mean, I know you do a lot of end-of-life work. What sort of tools do you have? Scales? What are the conversations that matter the most?
So I use a survey. I mean, there's multiple, but the one that I have used the most and like the most is out of Ohio State University. That is my alma mater. However, it's not the reason I use it. I just think it's extremely helpful in terms of how objective it is, and it's a scaling system. And frequently I will have that sent to my clients if they are scheduling a quality of life and or if they are struggling with scheduling a euthanasia and they would like some form of confirmation. And I typically have all of the family members fill it out, sometimes together, sometimes separately. I have found, depending on the dynamic of the family, sometimes separately can be better, because if they're together and they're arguing about it and trying to pick something, sometimes it's interesting to see, the husband, the wife, or the daughter, the grandma, or whatever, it doesn't matter. And they all kind of fill it out, and then we collectively have a conversation about it. And the other thing that I do offer is examinations, right? Because I very frequently, and I know you had another veterinarian on your podcast about pain. I frequently, this is something that is very, very important for, I think, all pet owners to understand, is that pain does not equal vocalization. I hear almost weekly, oh, he's not in pain, he's not crying or whining. And that is a very, very big misconception. And I know that you've probably experienced this in practice yourself. It is rare, right, for, definitive vocalization constantly to happen as a pain response. And if it's at that level, then we're a little concerned, right? We all know that, the dog that got hit by a car or something that's just, screaming and that kind of thing, but it's pretty rare. And even there are plenty of dogs that have been literally run over and make zero sound, right? Zero. Mm-hmm. So yeah. I think the vocalization, or the pain and vocalization thing, is a big misconception, and something that I would really encourage owners to stop using that language, and also, if they are concerned about their animal's quality of life, to have it assessed by a veterinarian, and particularly because I do a ton of chronic pain management and a lot of orthopedic and neurologic cases, obviously non-surgical, right? But that is something that is super, super important. And so examinations, right? Because they're not sitting there taking joints through range of motion. They're not palpating their dog's back. They're not dental disease. I told you there was a number 3, so we need to go back to that. But dental pain is one of the most significant pains that can be experienced both in humans and in animals. But right, our animals have this, they have a propensity to hide their pain and their suffering because of their survival instinct. And particularly cats, as you know, I mean, cats are just like, I mean, they could have kidney values that aren't even readable and they're just walking around like nothing happened. And I think that is something that's very, very important to have somebody assess for pain and discomfort, and particularly dental pain, because a lot of clients are not looking in mouths. And I have just been blown away by the level of disease that I have found by simply just taking a look. And we know it's painful. We do.
Incredibly. So. Yeah. I mean, with the end-of-life work that you do, what are some of the common regrets or misunderstandings that you see from families who look back at their pet's final phase?
So I think the most common that I see is waiting till it's pretty end stage suffering and not planning from a perspective of knowing what services are available, both end of life and aftercare in terms of like cremation or aquamation. And I would certainly say that waiting too long is probably the most common thing that I see. And owners are very, very upset by that because they can see that their own personal emotions and denial and struggling with the decision making has caused more suffering.
I mean, euthanasia is such a loaded topic. How do you articulate the idea that it can be an act of love and not just giving up?
So the literal translation of the word is good death, right? And I like that's actually on my website. And so I think it's really important that people understand the advancements that veterinary euthanasia has come across, because we do our utmost best to provide a passing that is completely painless. And that involves using high levels of sedatives, pain medication, and anesthetics, injectable anesthetics, right? And I'm not familiar with the practices in where you are, but we in the U.S., I think the palliative care and end-of-life community has really honed in on protocols to eliminate pain in the final time, right? And to me, I think there are a lot worse things than death, to be honest with you. And I've worked in shelter medicine. I've done multiple trips overseas to different countries and service trips, veterinary service trips, and I can tell you there are a lot worse things in this world than a good, dignified, painless death.
Mm. I know we're running out of time, but I don't want to miss the opportunity to talk about the good stuff.
Yeah.
What gives you hope in the work that you're doing, either in the integrative tools that are available, in the way that pet owners are beginning to think about pain or mobility or aging?
I definitely think the aging thing is very encouraging. I think it's still going to take quite some time, but in general, I do think that a lot of pet owners are understanding that age is not a disease, although I think we still have a little bit of a ways to go. I am excited about some of the changes in dietary recommendations for pets. That's really exciting. And that's a loaded topic, which we don't have time for. But I think a lot of the options for diets have expanded quite a bit, even just in the short time that I've been in practice. And I think the non-pharmaceutical and regenerative medicine world it's been around for a while. And have been involved in that for quite some time, both on the equine and canine side, and then also for myself. I've had a large amount of PRP injections myself. And I think the non-surgical options that we have for orthopedic and neurologic conditions is very exciting, because not that surgery is not a great thing. And, I am not anti-surgery in any way, shape, or form, but a lot of the products and regenerative medicine that is coming out on the market is very exciting to me. Both for me as a practicing veterinarian, because I can offer those things within my practice, and it doesn't require any kind of sedation or surgical prep, which is really cool, because I used to do a lot of joint injections, and there are a couple products out now that are they're non-surgical. They're like IM or sub-Q injections with regenerative properties.
So before we close, what's the one message every pet owner should hear before their next vet visit? Something that would change how they possibly interact with their vet and their pet's care?
I think the most important thing is kindness and patience, to be honest with you. I think everybody is, we're in this world that's very fast paced. There's a lot of technology. There's a lot of rushing, right? We're rushing to do everything. And I think one of the most important things that people can understand is, like, we are still humans, and hopefully we can still be in a human world amongst the technology that we have, and giving all of the staff, right, some level of grace for, from the minute you step in the door to the assistants, to the technicians, and then to the veterinarians. And I think if you have grievances or misunderstandings, or you need more clarification, ask the questions, right? Ask the questions to the veterinarians. And if they are unfamiliar with a certain thing, then, see if there's another option, right? And it doesn't mean that veterinarian is a bad one, or that they are purposefully trying to sell you something, not sell you something, put a certain idea in your head. I think having an open conversation with your veterinarian about things that you're curious about is the most important thing. And hopefully those other veterinarians are going to be able to work well with their colleagues at different clinics, at different, mobile practices, and we can all work together instead of against each other.
Absolutely. It's a common goal,
yeah.
Common interest. So I totally agree. Thank you. If people want to find you, follow you, where do they find you?
Predominantly Instagram is, where I'll put the content out. And, if they are in Arizona, they're more than welcome to go to my website. I do have some patients travel from relatively far away. So I do have a standing office that I do see, I do some treatments in there. And then I have a mobile practice as well. So I would love to interact with people and hopefully provide some really interesting advice and a little bit of a different view on how we look at things.
I love that. Thank you, Dr. Emily. Thank you very much for sharing your insight and for your experience and for your time today. Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.